Hello and welcome to Code Rhetoric with Tam Talk. In today's video, we will be discussing the selection of principal diagnosis. Our ICD-10-CM General Coding Guideline states that for previous conditions, if the provider has included a diagnostic statement, such as the discharge summary on the face sheet, it should ordinarily be coded. Some providers include the diagnostic statement, resolved conditions, or diagnosis and status post procedures from the previous admissions that have no bearing on the current stay. Such procedures from previous admissions that have no bearing on the current stay, such conditions are not to be reported and are coded only if required by the hospital policy. However, history codes ranging from Z80 through Z87 may be used as secondary codes if the historical condition or family history has an impact on current care or influence the treatment. 10-CM General Coding Guideline further states that with abnormal findings such as the laboratory, X-ray, pathologic, and other diagnostic results are not coded and reported unless the provider indicates their clinical significance. If the findings are outside the normal range and the attending provider has ordered other tests to evaluate the condition or prescribe treatment, it is appropriate to ask or query the provider whether the abnormal findings should be added. Please note, this differs from the coding practices in the outpatient setting for coding encounters for diagnostic tests that have been interpreted by a provider. Now, as we move into our first coding example, our patient was diagnosed and treated for pneumonia. The patient also has hypertension and his medications were adjusted. The physician also noted a history of dermatitis from prior admission, which has resolved. The hospital does not require that resolved diagnosis from previous admissions be coded. So what should our ICD-10-CM code assignment be? We're going to assign J18.9, which represents the pneumonia, and I10, which represents the hypertension. Our reasoning or rationale for the code assignment is, again, the patient was diagnosed and treated for pneumonia as well as hypertension during this particular admission. Therefore, these should be the only codes assigned. We would not assign a history of dermatitis as it has no bearing on the current admission and is not required per the hospital's policy. In our next example, Dr. John notated an abnormal finding of scar on Mr. Smith's chest X-ray. The patient was discharged without further instructions or treatments for finding. Should we assign the ICD-10-CM code for the abnormal finding or query the provider? Our rationale. So per the coding guideline, if the abnormal finding is not treated or can't be easily inferred of management, the coder should ask the provider if the abnormal findings should be coded. So this concludes our video for selection of principal diagnosis. And I'll leave you with coding tips as always, and that is the first is to remember to reference your coding guidelines and other reputable sources for clarity. Remember to always code to the highest specificity. And lastly, when in doubt, communicate with your coding leadership on the process or query the healthcare provider for clarification. If you would like to learn more about Abraham Medical Coding Coach, please follow us on YouTube at the Abraham Medical Coding Coach, Abraham channel, or visit our website at www.abrahammedicalcodingcoachllc.com. We also have our coding blog, which is titled The Medical Coder Post. We're on Facebook as well as Instagram and Tumblr. Thank you.